Okay, guys, we'll be starting a new subject on the channel, and as tradition demands, we have to actually make an introduction to this channel so that you guys have an overview of everything that will be going on to talk about in this course or topic. All right, so we'll be having an introduction to the what? Introduction to biochemical concepts of renal function and their use in clinical medicine. Introduction to biochemical concepts of renal function and their use in clinical medicine. So first of all, let's define it and look at the various things that we actually be looking at when talking about in this course, okay? So the biochemical concept of renal function may play a crucial role in understanding the kidney's role in maintaining homeostasis and the overall health of an individual. Okay, kidney plays a homeostasis, like trying to how will I put it, trying to maintain or trying to balance water and acid levels, okay, and all those stuff are the roles of the kidneys, trying to balance the electrolyte levels and the rest of them, okay. So in these biochemical functions, biochemical concepts of renal functions, we'll be looking at all these roles that the kidney plays in the body in order to maintain homeostasis. All right, so the kidneys regulate various physiological processes, including what? Electrolyte balance, acid base balance, water balance, waste removal, hormonal regulation, blood pressure control, okay, and the rest of them. Now let's talk about this. Hormonal regulation, you know that the erythropoietin is being produced by the kidney. Erythropoietin is a chief hormone in what? Erythropoiesis. For water balance, basically, when you take in much more water, you excrete much more water through your kidney because you don't really need water again. But in conditions where maybe like you are dehydrating, okay, you actually get to form very concentrated urine because much water is needed in the body, so this water was reabsorbed back into the body. Do you understand? So these are just how the kidney plays a lot of plays a lot of what do they call it? Plays a lot of games in trying to maintain the homeostasis in the body, right? So the biochemical concepts essential for understanding renal function include glomerular filtration rates, renal blood flow, tubular reabsorption and secretion, how your tubules are functioning, electrolyte transport, all right, pH regulation and hormone regulation, okay? That's a renin, angiotensin, aldosterone system, right? So now in clinical medicine, understanding biochemical concept for renal function is vital for what? Diagnosing and managing kidney diseases like what? Chronic kidney disease, acute kidney injury, okay? So it is important in diagnosing kidney diseases, all right? Learning this course will help you diagnose and even manage kidney diseases, right? It's also essential in monitoring renal functions in patients with comorbidities like diabetes and hypertension. It's essential in adjusting what medication dosages and fluid management. It is also essential in interpreting laboratory results like electrolyte levels and urine analysis, right? Also, it's essential in developing what? Treatment strategies for electrolyte imbalances and acid-base disorders. Okay, so now some key biochemical tests used in clinical medicine to assess renal function include tests to access serum creatinine levels and blood urea nitrogen. That's a BUN. Okay, so you could do a test to actually access the levels of um, all these things. Okay, then urinalysis. Urinalysis is just like a general urine test, okay, where you are accessing for protein, glucose, electrolytes levels in the urine. Then electrolyte levels too is still the sodium, potassium, chloride, okay. Then renal function tests like the glomerular filtration rate, then renal blood function. That's our renal blood flow, sorry, renal blood flow. Then hormonal levels, you are looking at the renin and the aldosterone, okay? How they actually get to like communicate to regulate pressure, blood pressure. Okay, so now by applying the biochemical concept of renal function, the healthcare professionals can better understand kidney physiology, they can better diagnose conditions and better manage kidney related disorders. Okay, and this can help you improve the patient's outcome, okay, or improve the possibility of a patient recovering from a kidney disorder. Right. So guys, that's it about the introduction to this course. We have like 40 videos coming on it. All right. We have videos on the different kidney diseases, different kidney tests, and all. It will be fun, guys. Right. So just stick to my YouTube channel. If you are watching this video after a long time, you could just go to our playlist and try to locate the playlist on biochemical concepts of renal function and the use in clinical medicine. Okay, so that's it, and bye for now.